Right, I've just put it live to YouTube, so we're good to go whenever you are, Chairman.
You ready to go, you say, Pippa?
Yes, whenever you are.
Okay. Okay, I will start then. I would like to start by welcoming those members of the public and press who are watching the live stream of this meeting through the Council's YouTube page. Due to government guidance on social distancing, the meeting is taking place remotely in accordance with the legislation. In order that this meeting will run smoothly, I ask several things from members. Firstly, that you keep your video cameras switched on at all times, with your microphone muted except when invited to speak. Officers will join us to introduce their reports in the usual way. Any members wishing to ask questions or make comment should indicate this by clicking the raised hand function on the bottom left of your screen. I will invite you to speak. Please unmute your microphone, make your comment or question, and then mute yourself again. As with all new systems, we may indeed run into technical problems. And for this, I ask your patience. Should this occur, I will declare an adjournment while the fault is addressed and the public broadcast will be paused. If it's not possible, then the meeting will be adjourned until such times as it can be reconvened. If your connection fails during the meeting and you're unable to reconnect, one of the Democratic Services team will contact you. Finally, I would remind members that all virtual meetings are recorded. And before we move to the first item, and we begin to call out the names. So, Pippa, could you do a roll call, please?
Yes, thank you, Chairman. So we can confirm that you're present. Councillor Fitzgerald, could you confirm your presence?
I did press my space bar, Pippa, honest, but I've done it again in the old-fashioned way. Yes, I'm present and correct.
Thank you very much. Councillor Allen?
I'm in attendance.
Thank you. Councillor Ayres?
Present.
Thank you. Councillor Sereste?
Hello.
Thank you. Councillor Farouk?
Present.
Thank you. Councillor Hiller?
Yes, I'm here, Pippa.
Thank you very much. Councillor Seaton?
Present.
Thank you. Councillor Walsh?
Yes, I'm here. Thank you.
Thank you very much. And Councillor Bashir?
Good afternoon and present.
I think that makes us all present and correct, I think.
That is.
So no apologies of absence. So do I have any declarations of interest to declare? Anybody got any declarations of interest? Well, if you weren't interested, you wouldn't be here, would you?
No one's raised their hand, Chairman.
Right. Okay. Minutes of the Cabinet meeting, the 22nd of June. I think Councillor Walsh has got some things he wishes to query on those minutes.
Yes, I have. Thank you, Leader. I'd just like to draw attention to a couple of items where I think just a typo has occurred, but it could confuse meaning. So one would be on page 4 under test and trace. And there are a couple of figures there, test and trace, and I think it ought to read 24 from 48 hours, or am I not correct in assuming that?
I think that should be reduced to between 24 and 48 hours. Does that make sense?
Yeah.
Yeah, I'll change it to that.
All right, thank you. And the other item is also page 4, the last bullet point. And I think it should be members were advised.
Sorry, where was that?
That's page 4, last bullet point. Members, and I think it should read were advised.
Sorry, the last bullet point on page 4.
Yep. Yeah.
I've got there at the moment, comment was made in relation to the recent news that vivacity, is that not the sentence that you're looking at?
Sorry, Pippa, I actually moved off the page myself there, and I'll just get it. Sorry for this delay. I'll just get it in front of me again. Yeah. So it's okay. Yeah. Last bullet point on page 4. Transfer services back to the council, and members advised that it was currently too early. Now, did the members advise, or were the members advised by someone else? So is it passive tense or is it active tense on behalf of the members? So is it members advised or members were advised?
Obviously, I'm happy to be guided by you, but I believe that was something Councillor Holditch said.
Yes, it was. Yeah, true.
I'll leave it as it is. Thank you.
Can I bring
Yeah.
a further point to order on that one, on that same bullet point, please, Pippa? I think it should say it's 90-day transition period rather than it's 90 transition period. Thank you.
Yeah, thank you. I'll correct that.
Right, members, are we? Councillor Seaton, you've got your hands up. You got something on that? David, have you got something on the minute?
Thank you, Leader. Yes, it's on the minutes. It's item 5 on the minutes, where it states that, it's the third paragraph, advised that as part of this scheme, the government had awarded funding for businesses which had been allocated to small businesses. Clearly, that's not quite right. We're in the process of allocating it. That allocation has not yet been done.
Thank you, Councillor. I'll make that amendment.
Thank you, Pippa.
Okay, with those amendments, are you now happy to approve the minutes? I don't see any objections from anyone. Do you, Pippa? Do you want a second? We better have a proposer in a second, don't we? Better do it properly. Do a proposer with those amendments that you accept the minutes, please. A proposer?
I'm happy to do it, John.
Right, Councillor Fitzgerald, the seconder.
Peter's got his hand up, I believe.
Right, Peter, thank you very much. Everybody in favour now? Yes? Okay, thank you very much. Right, there, we got through that. So, strategic decisions. Peterborough City Council's response to COVID-19. I think this is going to go to Gillian in the first instance, isn't that?
It is indeed. Thank you, Chairman, and good afternoon, everyone. So this is our third report to you on the Council's response to COVID-19, and it covers both response and recovery. And as you can see from the content of the report, it's quite wide-ranging in its content. The first section, main section, deals with test and trace. And Chairman, I am going to hand on, after I've spoken, to Dr. Liz Robin to talk about Peterborough and give you an update on the virus situation, and particularly because we've had some other data through recently, and there's some actions that we need to take. And I'm going to leave Liz to properly brief you on that when I finished just giving you an overview of this report. The report, as I said, is wide-ranging. There's a section on the Shielded programme, which, as you know, is paused from the 1st of August, and it discusses in that section, which is section 7, what that actually means in practice to the teams who've been working on the Shielded programme. We also cover off the continuing discussions that we're having with vivacity in that 90-day period. But there's also a section around children's education, and I draw you to particularly to paragraph 10.3, where we have the announcement about from September and the detailed guidance that accompanied that. And we set out the guidance in relation to that in paragraph, as I say, 10.3. There's a really important section on children's services in the light of the society easing the lockdown and how we're developing proposals about how some services might begin to reopen, but more importantly, what the new models of children's care might look like in the post, if you like, COVID world. So that's also covered off in the report. As you would expect, there is something on adult social care around the infection control fund and how we're deploying that. but also our approach to the market for the care and some new models that we're developing around the care sector. Further on in the report, there's information about our bereavement service, and as you can see from the table in paragraph 16.1, the number of funerals have stabilised and are coming back to normal numbers. But we also cover off the fact that we've had to catch up on the registration of births, and in 17.2 you'll see that that backlog is being tackled. We've also opened for notices of marriage and civil partnerships, which happened from the 4th of July. And there's a section about how we're handling weddings in subsequent paragraphs. The report also goes on to our place-based services in relation to waste, and you'll know that we've opened our household recycling centres. And you'll also be aware that fairly recently we started the garden waste collection up again, and there's a paragraph about that. There's also a paragraph about highways and transport in relation to active travel work and some funding that we received in some schemes that we started to implement in relation to that. There's a section on housing and how we're tackling homelessness, but also rough sleeping and how we're moving from the, if you like, the provision that we've provided in hotels back into getting people back into homes in the community. Our city centre, as you know, has reopened, and we had good news last week that John Lewis is actually going to open on the 30th of July. I ought to declare an interest at that point because that was really good news for me, but I think good news for the city overall. And you can see, although we've not gone back to the numbers that we had before, the city centre reopening has been successful, and we've worked very closely with the combined authority on that. There is also a section on the recovery framework, which is still developing, and we'll be coming back to you in more detail with some of the recovery plans that we're developing as we go forward. The last section I think is important because it's about our workforce. We did a workforce survey, and some of the results of that survey is set out there. Today, we're launching an e-learning module for staff, which talks about if you are returning to the workplace, how we're supporting both the safety of people, but also how the workplace will look different as people come into that new environment. So a really important part about supporting our workforce, not only in returning to work, but there's also a section about how we've deployed some mental health training and support to our workforce during, in the recent past, but also going forward. So, Chairman, it's a comprehensive report, as you can see. It covers a lot of information, but I think one of the most important things is around how Peterborough stands in terms of its virus situation. And that's why I wanted to invite Dr. Liz Robin to give us an update, because I do think it's something we need to take some care about discussing today at Cabinet. So if it's okay with you, Chairman, I'll hand on to Liz.
Thank you, Liz. Are you in? Yes, she is.
Yeah, yes.
Go ahead, please.
Thank you. So, as you know, we're monitoring all the cases and other epidemiology across Peterborough and Cambridgeshire on a daily basis through our surveillance cell. And we've been looking at cases over the last 4 days since the paper for Cabinet was written. So the paper says that overall, our COVID-19 cases are trending downwards, which was the case when the paper was written. And that's still kind of true overall, because we're much lower than we were back in April, May at the peak. But just over the last few days, we have seen a small upturn in cases. So not huge, but we're more at levels that we were between, say, about June the 20th and June the 26th. So a slight upturn from that downward trend. And we know that we need to take anything like that seriously and monitor it very carefully. And indeed look at all the actions that we're taking. So we've known for a little while that Peterborough's Pillar 2 test results are higher than the national average. And as I've said, keeping a very close eye on them. We're also taking proactive steps to reduce the number of people who get infected in the first place or spread it to others if they do become infected. So in the last 2 weeks, we've launched a more specific local prevention campaign called Keep Caring, which we are updating today to pick up messages from other areas who have higher levels of community transmission than we do. And we'd like Cabinet to help us share these messages, and we'll be sending round links after the meeting. We're also training more people in our own organisation from partner organisations and in communities to take the key public health prevention messages out. And we will be working with local Facebook groups to start conversations about prevention messages and busting any myths which may prevent people from getting tested or prevent them isolating when they've been in contact with people who have tested positive. And that isolation is for 14 days. Our rapid response team has been working with communities in higher risk areas and with landlords of private rented accommodation to increase the information that they have. And we're targeting areas where we see outbreaks with more detailed information, and we will be delivering that door to door and on social media. We're working with faith groups and community leaders to help us get messages to people in the right ways at the right times and in the right languages. And we're working to improve access to testing in Peterborough to make it easier for people to get tested quickly so that they can break the cycle of infection. So that's just a summary of some of the work that's going on.
Thank you, Liz. Before I go into open questions, I think, Irene, you had a question on the wording in the report.
Yes, thank you, leader. Yes, Liz, thank you for the excellent report. It was just, and I'm sure this is good news to, add to what I think is the positive picture that you're painting about what we're doing in Peterborough. But it's on page 2, paragraph 4.3, and it is the last sentence, which I'm a little bit puzzled about the meaning of, where you talk about the death rates that account for the age structure of underlying resident populations indicate that COVID-19 related deaths are statistically significantly lower. So could you just explain that to me, please, Liz?
Of course, Irene.
In English, please.
Yes. When you look at the number of deaths from anything per 1,000 people, let's say, which is something we do quite a lot in public health. We might say that deaths from heart disease are 100 per 1,000 people, and that's higher than somewhere else where there are only 50 per 1,000 people. We like to see how we're doing, to see where the highest risks for our population are. And we do that by comparing rates of death per head or per 1,000 people. When you do that, what you find is that it's very influenced by the number of people of different ages in the population. So, for example, if you were looking at deaths from dementia, if a quarter of your population was people aged over 80 who are at higher risk of dementia, you would probably have more deaths from dementia than if only 1 in 20 people in your population, the 20th of population was aged over 80. So you can see how that would work for deaths from dementia, that you'll get different rates if you had a different, what's called age structure for your population. And in reality, that works for nearly any cause of death. So we know that COVID-19 deaths are very strongly related to age, and that the risk of death is much higher the older that you get. So the same thing applies. If you really want to compare 2 different areas, you can't just say that a certain number of people died out of every 1,000 people. You have to do a mathematical adjustment for the ages of people in that population. So that's what that means. It means that if you, and essentially in simple terms, it means we did the maths properly to really compare Peterborough with other areas in a robust way that took into account our age structure and that we have a younger population, and that still showed that our COVID-19 death rate was lower than average.
Fine. So just for absolute clarity then, Liz, what we're saying is that the age bands that are considered in relation to COVID-19, that like for like, we're comparatively doing better than other areas in the UK.
In terms of deaths attributed to COVID-19, yes.
Right. Thank you. That's really important. Thank you.
Okay, thank you.
Okay, I think that's a difference between common understanding and health jargon.
Yeah.
Okay, Councillor Bashir.
Thank you, Leader. And through yourself, I'd like to ask Dr. Robins, what is the targeted prevention that you have done in Peterborough?
Okay, so we have been doing some targeted prevention right from the start of COVID-19. So when we went into lockdown, I think Peterborough may well have been the quickest in the country to translate the key lockdown messages into a variety of languages, with community leaders doing that translation on video blogs and making sure that that information got out to communities. So I would say that throughout we have been working hard to make sure that we were able to target messages to the full diversity of our population, and that's been a key feature of what we have wanted to do here, with particularly working through our cohesion team and communications team. That's been strong, and we have continued to work with community leaders from a variety of communities in Peterborough throughout. More recently, we need to be aware, as we learn more about COVID-19, that there are some risk factors for certain areas potentially being more at risk. And those can be areas where there are more social and economic issues, where housing is more crowded, where there may be more different languages spoken, where people may be in jobs where it's harder to social distance, and so on. So there are some areas of Peterborough which are at higher risk, and we have our rapid response team, which is multi-agency across the council, different directorates in the council, also involving police and others, environmental health, communications. That team has been working particularly hard in areas, the Millfield and New England areas of Peterborough, to make sure that they work with businesses, that they work with takeaways, that they had messages out there, particularly with the reopening of some of the hospitality sector and other shops. So that work has very much been going on in terms of targeted prevention, and that needs to continue, and we need to really engage with our communities and community leaders. Some of the messages absolutely need to be very clear and very well, we'd say in technical terms, segmented or targeted, to make sure that we're communicating with people in the right way. And we'll continue to work on that.
Do you need to keep reinforcing them then?
Absolutely. I mean, that's the same with any public health campaign. You keep having to reinforce the messages, and you keep having to find slightly different ways to convey them to keep people's attention. And it's very, very important because COVID-19 is absolutely still with us and still circulating in the community. It's really important that we just keep those messages going and find lots of different ways to convey them.
Councillor Seresti, I think you have a question.
I just have to unmute a second. What steps are we taking when we're providing services to our more vulnerable people to make sure that they stay safe and we don't put them into some sort of danger, if you like?
I think, in a sense, you'd need to speak to each service, because this is very detailed, Councillor Seresti, but yeah. Our services all put a huge amount of work into ensuring that they follow the advice and guidance around COVID-19 and that they work in ways that keep people safe. So that's happening absolutely across the council services. And I can reassure you of that.
Thank you, Dr. Robin.
Councillor Hiller?
Yes, thank you, Leader. It's interesting, leading on from what Liz was saying. I read the Daily Mail today, and apparently we're not in the top 20 of cities likely to be involved in a second lockdown. So I think that's reasonably encouraging. So fair play to all of our officers, especially from the medical point of view. So that's good news. My question, Leader, is probably for Steve Cox, I would think. I wondered if you could update on the new cycling and pedestrian measures that we've implemented in the city. And as a second part to the question, Is there any news about the second, not insignificant tranche of money that we're likely to receive? Thanks, Lee.
Steve?
Yes, thank you, Councillor Hiller and Leader. Yeah, the work's on tranche 1 of the active travel funding is progressing well, and the reallocation of road space, I think, has helped with the safe social distancing as part of the city centre reopening. We put measures in on Broadway, Cattle Market Road and Crescent Bridge, and we're continuing to monitor traffic flows and expect to have some of that information available very soon. Pop-up cycle lanes will be following in parts of Broadway, City Road shortly. We've been in touch with businesses in Cowgate, King Street and Cross Street, and we'll be looking at the proposals and comments that come back in conjunction with traders and how we go forward from there. On the tranche 2 funding, so the second tranche that was announced when the active travel was first announced, we've had now guidance come in over the weekend, and this would release for Peterborough something of the order of £600,000 of second tranche funding. You'll recall from the first tranche that the strength of our bid enabled us to get 12% more than we were allocated. So we'll be doing the same again to demonstrate delivery of tranche 1 and to put in a strong set of proposals to secure as much of the tranche 2 funding over and above our allocation as we can. The submissions for tranche 2 need to be made by the 7th of August, so we'll be working over the next couple of weeks to put some ideas together. They will still remain temporary or permanent. Active travel measures will be looked for from government for that second tranche of funding. And the schemes have to be implemented over this financial year. So there's a lot to be gained and a lot to be secured and work to do over the next 2 or 3 weeks to put in the best possible bid we can to secure that.
And the difference of that is that we can now do some permanent work as well, where before we couldn't.
That's
okay.
right.
Yeah. Okay.
Yeah, thanks for the response, Steve. That was very informative. One thing I would say, at risk of stating the obvious, is that we've got to try and increase the cycling in this city, in and out of this city, rather than just offer a provision to facilitate cycling. I personally would like to see a significant increase in both cycling and pedestrian use. I'm sure you'd agree with that.
Okay. Steve Allen.
Thank you, Leader. And if I can pick up on Gillian's initial overview report, on page 5, 10.4, it identifies that school transport is going to be a challenge. And it goes on to say that use of public transport by pupils should be kept to an absolute minimum. Now, I have some concerns on that because sitting on the strategic bus group for the combined authority, the thrust of that group is now to encourage the use of buses again, because that is considered to be a sensible way to get people around rather than using cars. So it's somewhat contradictory. And I also believe that we are trying to have, car-free zones around the schools, which is laudable. But unless people use bikes and they're more likely to get in their parents' cars to get to school, we're kind of competing with ourselves with the message. Can I just have an overview on that, please, Gillian?
Sorry, Chairman, I wonder whether Wendy would cover that for us because it's education. Thanks.
Thank you, Gillian. I was trying to get my blue hand up quickly. Thank you, Councillor Allen. You're quite right. Some of these things do contradict each other. From an education point of view, you will know that getting children back to full-time education is our priority aim. When those children go into school, they will be in bubbles to protect them and also the staff. So when it comes to transport, we've got to follow that same methodology so that we're not mixing lots of children up with other children. So that does mean that we then need to use more forms of transport, including asking parents to take their children to school. But we absolutely will be encouraging parents to walk or cycle to school as well. We are waiting for more guidance to come through, but at the moment our stance is, please parents, please can you walk your children to school? Please can you cycle with your children to school? but I certainly can understand where you're coming from and your concerns.
Thank you. I think it's just the fact that we have to make sure the buses work if we're going to maintain a decent service, and so therefore the combined authority, and I know that Mayor Palmer is going to be doing some PR on that soon, so I think we just want to make sure we are linked up with what we're saying, if I may.
Thank you.
I mean, there are several issues about school transport. If you take the 13 buses, I think it is, going to Arthur Mellors, and they're the great majority of the school buses that we use, and the rest of it are usually about King's School kids coming into the city. So it could be quite isolated. The other thing is, I suppose, what social services are picking up in their buses, and how you're going to control that.
Yes, Councillor Holditch, certainly that the whole issue of transport is being looked at the moment. I think you know that we're still waiting for more guidance from the DfE about it, not least of all the funding that might come down to support us with it. But it is a topic of conversation as we speak.
Okay, thank you. Councillor Seaton.
Thank you, Leader. Can I just first reflect on something that the Chief Executive said in her introduction and section 16, which is the Bereavement Service. And I think we should be really grateful to the Bereavement Service for what they have done in recent months. You know, that they have been on duty the whole time. And with, for example, the reduced numbers of mourners, that must have been a very difficult period for them. And I think we should be very grateful. My questions are for Dr. Robin. You know, clearly we're close to Leicester. We have some quite similar issues. So I think we really need to be explicit and honest with residents of the city. I saw that the Health Minister, Matt Hancock, said we're dealing with about 100 targeted outbreaks a week. Now, you've mentioned the city centre, Millfield, New England. Would that be included in those 100 targeted outbreaks? So that's one question. The other question is around, are we receiving data on test and trace locally? Are we receiving data on where the national test and trace system is contacting people in Peterborough? Thank you.
All right, Liz, I don't know whether that's for you or Gillian.
I'm happy to start. And in terms of, I'm afraid I didn't see the Health Secretary's speech where he talked about the 100 outbreaks, but I don't think that would be the Millfield, New England area, because that's not classed as an outbreak. It's just that there are more cases there. The sort of targeted outbreaks are where you can identify a care home or a school or a workplace where you've got a very specific outbreak in a setting. So my understanding is that that is what is likely to be what is being counted, because we receive that information and share that information with our local Public Health England health protection team around specific settings which have an outbreak. So hopefully that's helpful on the first question. Seeing more cases around an area is much more just around general analysis and epidemiology. The other question on whether we're getting test and trace data through, yes, we are. I get daily data through on cases and numbers of contacts and so on from the test and trace, so that's positive. What we would like to have more of is the more granular information from the test and trace, so that rather than just getting postcode data, which is anonymized around where cases are located, it would be helpful to have more information about workplaces or about contacts that would enable us to have a full understanding of the different, a fuller understanding of the different cases that we see. So I'm hopeful that progress will be made on that, because as local authorities, we are now playing a very strong role in the overall outbreak management system, and we need access to that information to help us do it in absolutely the optimum way.
Thank you. No, that's very helpful. I would have thought as well that, you know, if the national test and trace is unable to contact people, we could potentially play a local role in doing that if we have the capacity.
I think that's a very good question. I think at the moment we are in close contact with the Public Health England regional team, and they will ask us, they are looking at the outbreaks in settings, the ones that the Health Secretary was talking about. And if they are not able to speak to someone to find out, say, about their contacts and so on, they will contact us and we'll ask Environmental Health or others who know those communities to go and ask those questions. That has really started quite recently. So there is opportunity to do that in more complex settings. Clearly it would require quite a lot more capacity in terms of a more general follow-up, but I think it's definitely something worth considering and looking into for the future, yes, because we know that there are some people who are not, the national system's not able to follow them up. So yes, any way we can improve that.
Thank you.
Okay, I'm trying to leave Wayne to last because it's his portfolio, I don't care, but I've got Lynn has just put a hand up. Did you want a question?
Yes, if I can, please, Leader. It's about the city centre reopening. It's only a small question. I think it's probably for Steve Cox. On page 9, there's a commentary about the visits to the city and that they're actually down. They were down minus 55% from the pre-lockdown days, and now a minus 45%, which is obviously good because it's getting more people are coming in. But I'd like to know whether we think that that still means that the businesses can be viable, because of course at the end of the day how we go around this reopening is very important for the businesses, because they've got to be viable at some stage.
Thank you, Councillor Ez. Really important question. What we would like to get, and we will get, is the even more up-to-date information that shows what the footfall and numbers are like post the 4th of July. It's very difficult to give a view, I think, on an individual business by business basis as to whether that, what figure would result in them being viable. And I think it depends which sector the business is in. I think all we can do is make sure that we do everything we can to support businesses, making sure that their units, whether that's retail or cafe restaurants, are safe by supporting the social distancing that's required. But I think what we need to do is ensure that we get those figures as high as possible, so more people are returning into the city centre to give those businesses as good a chance as possible to be viable.
Thank you. Over to Wayne.
Thanks, John. It was just really just to reinforce some of the things that Liz has been saying, and also Gillian, that in light of the most recent data that's emerged in the last few days, and David touched upon many of the things that have also come across my radar also. But I think what we have to recognise is the eyes of the country are on Peterborough from a public health perspective, in terms of we are expected to keep on top of this. And I don't want to overplay the situation or, you know, put the fear of God into people, but we have to treat this seriously. I mean, we have the local outbreak control plan, and there was some discussion in there recently before this latest data about, you know, on the one hand, we want to encourage people to come out and go back to work, but at the same time, we also have to be realistic that it can tip in either direction. Now, I don't want to be singling out any community or anything else, but clearly, the evidential data and the granular stuff that Liz is talking about, we need to be more proactive and reinforce the public health messages again, and find different ways of doing them, as Liz also said. So the fact of the matter is that the message is not getting through, particularly in the bubble, the family, as it were, that there's contamination and infection ongoing that's causing these spikes, and we somehow need to address that. it may be a matter of resource. And David, to your point, I think we have to get into testing even on a street by street basis in those communities, and we have to move in quickly and get the resource from public health and get the forces involved in getting those tests turned around in 24 hours, because this could soon escalate if we do not nip this in the bud right now. And we don't want government intervention. I think Gillian would agree, you know, we want to be in charge of our own destiny here and being in control and getting on top of a situation where it's only a small section, you know, PE1 postcodes particularly, that we could have an outbreak of, you know, 200 people in a community because it's being spread within that community, because the rules aren't being followed on social distancing. Because whilst it's great to be proactive and lockdown is easing and we can go out, do this, that and the other, this virus has not gone away. And it will spread like wildfire if we're not on top of it. So I just wanted to stress that there are discussions and plans, and it might be that we have to get into those communities, you know, down and dirty at the coalface, and start testing on the ground at the very front of this. And again, get our teams, public health teams, we may need some more resource on that, get them in working with communities. And it's not one particular community. I would say it's more about postcodes, streets, you know, areas, because there's mixed communities in all of those places, but they tend to have larger family groups. And that's where the problem is, we think. And that's where the problem has been identified in Leicester by and large. I don't know if Liz, do you want to say anything, or Gillian? But I think that's the gist of it, folks. We have to take this seriously and get cracking with it.
Gillian, do you want to say something?
Just to agree with what Councillor Fitzgerald has said, and I think outlining some of the more detailed community interventions that we're making is what Liz was covering off in what she said. We do need to step that up, and I think through the social media messages and others things that Liz has described will be some of the ways in which we will do that direct, if you like, targeting. And I totally agree with the point you're making. We shouldn't think we're like Leicester, because that isn't what this data is showing. But what it does show is what you've said, Councillor Fitzgerald, which is we want to be masters of our own destiny. We want to nip this in the bud, and we want to use all that community resource that we've got, together with the leadership of yourself and others, to make sure those public health messages are absolutely conveyed, so that we keep our city open. And I think we shouldn't be complacent. We've got some really clear plans, and we all need to put our shoulders together to get those messages out and to get into those communities to make sure we do get those public health messages clearly understood.
Thank you. I don't have any other speakers. So you're happy to note the report? Can I have a mover of that, please? Councillor Seaton, are you moving? Councillor Peru?
Yes, John, I'll be the mover. Thank you.
Okay. Can I have seconder Seaton? David Seaton, you seconded?
I'm happy to second, Leader. Yes, thank you.
Thank you very much. So do I have any dissension on that at all? Can't see any, Pippa, can you?
No, there's no hands up.
Okay, so that's agreed. Okay, thank you very much. Then we're moving on. That was a good debate, I think. I approve the recommendation set out in this report. This is about the budget setting process. So over to you, Councillor Seaton.
Thank you, Leader. Yes, agenda item 5. The report adjusts the Council's budget policy framework procedure rules from a rolling budget approach to that of 2 distinct phases, one for consultation in the autumn and the second in spring. The 2020-21 process was specifically approved by full council, so this report regularises the position for 21-22. The report was due to be presented to the Constitution and Ethics Committee in March and then council, but with that committee not having met, this route is being used to ensure that change can be approved at full council. Just to note, section 4 of the report sets out the timetable and consultation requirements for the 2 phases of the budget. Appendix A is the updated portion of the Constitution taking on board these changes, with section 6 being the budget and policy framework procedure rules of that Constitution. So Cabinet requested to endorse the updated framework and recommend the changes to Council for approval. Thank you, Leader.
Councillor Ayres.
Thank you, Leader. Yes, could I ask Councillor Seaton whether you could just expand upon that matter for me in sort of easily understood terms, please, why the change is necessary?
David?
Thank you, Councillor Ayres. Our Constitution talks about a rolling budget with 3 budget setting processes a year. And as we can't do that this year, and I think the biggest problem we have is the uncertainty around COVID on our budgets. So we're going to move to 2 phases, an autumn phase and a spring phase. And because therefore we're not adhering to the Constitutional Council, we have to seek Council's agreement to do that. I hope that helps.
That's clear.
Yes, thank you very much.
Councillor Walsh. Councillor Walsh, yeah, got your hand up.
Yes,
Yep.
sorry, I'm here. Yeah, it's yeah. Yes, I'd just like to ask on. So, as I understand it, then we just simply want to enshrine into the Constitution the new, not the new, but this method of looking at the budget. But can I ask? If something comes, it's something significant and something, you know, a recommendation comes forward which would make significant changes, positive changes to our budget, how would we deal with that within this framework?
David, Peter?
I will touch on that, Councillor Walsh, within the next item, and I'll go into some detail about it. So if you don't mind, I'm very happy if Peter Carpenter would like to touch on it now, but I will cover it off in the next section. Peter, would you like to add something?
Yes, thank you, Councillor Seaton. I think the issue is, in overall terms, when we did the finance review processes last year and the FIT process, one of the recommendations from that was to go back to 2 processes, a 2-stage process for the year, because the overhead and the amount of meetings that need to take place to do it 3 or 4 times a year is just an overburden on the council. Now, as long as we can get to a 2-stage process, we give at least 6 months for an implementation, which makes it easier in the first stage. We're moving along that process, you know, so we've got a longer process to deliver to. The whole idea is to make sure we do things earlier. Obviously, if we want to do something in the budget for this financial year, there's nothing stopping us doing it and actually doing it through the monitoring process for this financial year. This only affects the next financial year.
Thank you, Peter. Members, are you happy to note the recommendations on page 9? And that is to note the update of the new policy framework. Can I have a proposal for that, please? Councillor Hiller, thank you very much. Seconder?
Yes.
Councillor
Yes,
Ayres?
thank you.
Both. All in favour of that? Can't see any dissension. Can you sense, Pippa?
No, no objections.
Right, that's agreed then. Thank you very much. We'll now go to item 6 on your agenda, which again is a budgetary issue, and it's a budget control report. Over to you, Councillor Seaton again.
Thank you, Leader. You'll recall in May and June, I brought reports to Cabinet that set out the implications of COVID-19. As I've said before at Cabinet, we're internally tracking this on a weekly basis with regular updates by all councils in Cambridgeshire to the Gold Group and our MPs. I can bring you right up to date. in that at the end of June, we had total COVID-19 pressures of £30.8 million, taken against the £11 million of funding the government provided directly to councils, and ring-fence funding of £5.7 million. This leaves a forecast COVID-19 pressure of £14.1 million. As per the table in section 4.5, the deficit at the end of May was 9.9 million. Our updated projection across all budgets showed the net position to the end of May was actually 6.3 million. That's the net position, as clearly there are some areas that are spending less due to the pandemic. Although that's 0.4 million worse than April, the actual performance is slightly better, as during the month, COVID pressures actually increased by £2.6 million. So just to repeat that, COVID pressures increased by £2.6 million, but the increase in our net position was just 0.4 million. Clearly, we must still continue to focus on two key areas. Firstly, our transformation work, finding more offsetting savings. And secondly, our lobbying of government for additional funding. Let's be very clear, the current pandemic is posing a huge financial challenge for all councils, with particular concern about council tax and business rates. That could be a considerable sum nationwide. The updated detailed analysis of under and overspending is contained in Appendix A. It's also important to note that the council has promptly delivered the vast majority of additional funding that the government has provided to business over the past 12 weeks. Just as a reminder, that's included business rate relief of 36.6 million to 1,250 retail, hospitality and leisure providers, and business rates relief of 0.3 million to 31 nurseries, 29.9 million of specific grant funding for small rural retail, leisure and hospitality businesses. And we've actually issued 2,503 grants. We're continuing to add businesses to that list dependent on valuation changes and updates, and that's why the figure isn't 100%. We've given 1.75 million of grant assistance to care homes and £181,000 of grant assistance to reopen our city centre. Finally, we've also paid out around £375,000 of the £1.47 million discretionary scheme and are well on the way to completing our review of the remaining applications. This report also contains a section on the issues the council is having to deal with in approaching its 21-22 budget. That's going to be a difficult task given the challenges over additional costs and demand due to COVID-19, ongoing government funding uncertainty and the tax take. MHCLG have confirmed that the local government provisional finance settlement will not be announced until late autumn, which leaves us in an uncertain position. However, as a first step, we must plan growth and savings proposals to go out to consultation in mid-October in order to be sure we can deliver these fully next year. The second phase of the budget after Christmas will be clearer, as MHCLG will have had time to consider in its provisional finance settlement the true position for the sector. I also want to look to reflect upon the way forward more generally. Clearly, we've all been in response mode for over 3 months. Officers have managed our operational response in unique circumstances with great professionalism and kept us up to date throughout with weekly highlight reports and detailed regular briefings. We can see from the highlight reports that although we're still responding to the pandemic, Much of the response work is now our new business as usual. The COVID reports are now mostly operational, and as such, I think our focus as a cabinet needs to move to our strategic priorities, recovery plans, and the link to our budget. As the Chief Executive mentioned in her introduction, we will soon see business cases for recovery plans in individual areas. And these must link into the budget planning cycle. We need to have a really good grip on this as a cabinet, because inevitably it will be a challenge to afford all of the recovery work we'd like to see. And we will be asked by officers to make choices about where to focus our limited resources. We need a process which starts by being very clear about what we as a collective want to achieve, how we test that against different scenarios. To give you two, what if we do see outbreaks in Peterborough and heaven forbid a second spike nationally? What if we see an even greater than expected demand on adults and children's social care? And then costs those scenarios against baseline affordability. Whilst we will each look at and consider individual issues in our portfolios around recovery priorities, we must always consider these in terms of the collective impact on the budget. Our officers can make recommendations, but the final decisions will be ours. We'll also need to be very fleet of foot, very agile, and this touches on Councillor Walsh's point earlier. Proposals for recovery and for extra costs and savings could change quickly, and indeed could change often, as we find out how the economy and demand from vulnerable individuals and families unfolds. We must explain the budget story and recovery priorities in a clear and comprehensive way, whether to the Ministry, the MHCLG, the public, or indeed opposition councillors. My intention to manage the budget for next year is to develop a basic working model and then keep updating it as we go. In this period of not just national but global crisis, we know our financial plans will change. We know new challenges will appear, and we know support from government will have to evolve. We must be rapidly adaptable to respond. As officers and members, we must work together on a cycle of continuous review, analysis, and reprioritizing so we can deliver the biggest and best impacts from finite resources. In summary, our recovery work and our budgeting must move hand in hand. So today, Cabinet are asked to note the recommendations in this report, especially the requirement to continue to lobby for additional funding to minimise the effects of COVID-19 on Peterborough and the approach to the 2021-22 budget. Thank you, Leader.
Thank you, David. Very statesmanlike. Well said. So, Councillor Fitzgerald.
I just want to mute myself. I had too many screens in front of me. Probably for Peter and David, collective view really, is something I've asked Peter a number of times about the ongoing projected deficit and if it will be funded. And again, politically, folks, it's all our responsibility, but Peter may have an updated view. If it's not funded, what is your opinion then, which I suppose is why it's more relevant for you, Peter, about your opinion of the council's overall financial position? So where we are, what's the projection, and what if, but what, and maybe. So I suppose we'd all like to know the answer.
Peter, would you like to come in on that?
Yes, thank you, Leader. Thank you, Councillor Fitzgerald. In overall terms, we saw a week and a half ago the government offer another 3 tranches of funding. One of them, £500 million to be spread across councils based on the area cost adjustment, population deprivation. We thought we might get some sort of draft figures out at the end of last week. It's now going to be this week. That will be some funding towards it, but probably not particularly more than a couple of £1 million. The reimbursement of up to 75% of lost income is far more interesting. I was in a meeting on Friday with other directors of finance and the LGA where there was a lot of debate around this. In fact, if you look at some councils, cabinet equivalent to this, which are coming out today and tomorrow, some have actually assumed significant funding from that. The gist of the calls yesterday in terms of, on Friday, was that we think there are going to be significant carve-outs from that sum, and maybe the amounts might be less than 75-25, more 50-50. So where does that take us? And council tax and NDR, I think the government, although they've suggested us smoothing it over a 3-year period, that is substantial pressure on all of our budgets. For the whole sector, you know, for us, I've done an assessment, it's probably £4 to £5 million more revenue pressure a year for 3 years, which is absolutely significant. So where do I think we are? At the moment, if you really look at the May monitoring, we're overspending in net terms by 6 million, and that really will use the vast majority of our usable reserves, which means we have very little left. One of the other conversations on Friday, and part of the analysis the Local Government Association have done on the returns from June, there's over 100 councils that have responded to government and MHCLG to say actually they have no reserves to deal with COVID this year. And, you know, this is a national issue. And really, to become sustainable, we need COVID and COVID pressures to be properly funded. And really, not just this year, but future years as well. And I think this is where the government is wrestling at the moment. I see the biggest issue potentially, which is something David has mentioned, as being the local government settlement not coming out until very close to the end of December, as it was last year. And that doesn't give us a lot of time to plan. We can get up to a certain point, but again, we can't be too adventurous and yet or too passive in that first stage, because that will leave so much to do in the second stage. And again, it's something we will have to weigh up over the next 2 months as we go through the first stage of the process. So, Councillor Fitzgerald, in terms of the wider answer, us, like probably the vast majority of councils, if we look at it over this year and next year, need intervention from the government in one way or another to make us or put us to a road to sustainability. I mean, one of the biggest issues is going to be tax income going forward, because although tax income is down significantly for all councils at the moment, we've got to take into account that next year probably won't be brilliant either, and maybe the year after if we go into a deep recession. And so it's something that the government and local government have got to wrestle with to come up with a solution that works.
Thank you, Peter. Not good news, but
Leader, can I just add a point on that very specific thing?
Can I get you to sum up at the end, mate? There'll be some more questions in a minute, I would think.
I can cover it then. Thank you.
Yeah. Thank you. Councillor Walsh.
Yes, hello. Can I be heard?
Yes.
Okay, good. Thank you, Leader. Yes, thank you, Councillor Seaton, Peter Carpenter, and all your officers for putting together this report. Quite significant challenges, and I think we've all got to support you as much as we can, and we will, of course, in our various portfolio areas. What I just wanted to raise, and I'm sorry, I have to do this, it's an issue of presentation in the report. So you set out some the forecast overspend and variances in 2 different places. One is on page 26 of the report, and the other is in Appendix A of the report. One takes into account a further month, the Appendix A, than the one on page 26. However, I just needed to point out that they are not consistent in their color coding. So I am suggesting that the page 26 layout, if you look at the movement column, surely a block of those, 1, 2, 3, 4 of those ought to be red color because they set out variances and higher figures. So if I could just point that out. Otherwise, I'm very happy to support the whole report and the approach that you're taking.
Will you pick that up at the end, David, please? Councillor Farouk.
Thank you, Leader. My question possibly to both Pete and David. What do you see as the big risks in respect to monitoring positive and negative during the year? I mean, I know David's highlighted the risks already, which is government support, sack and spike, taxes paid, or the council's growth earnings. But what other risks do we see?
Who wants to take that?
Should I start?
Peter, yeah, go on.
Well, the risks are, and we've touched on one already one way or another, is additional demand for services as a result of the economic impact of a pandemic, and also how long that lasts. Is it 1 year? Is it 2 years? Is it 3 years? You know, quite significant. Where we're going to get in terms of funding from the government, because there's lots of other priorities as well. The solution to tax is probably the biggest of the lot in terms of how that works, but also it's significant for us in Peterborough because, you know, the less NNDR we're delivering, the less businesses there are in Peterborough, and, you know, the less people we potentially have working. So, you know, we want to maximise that in all costs. And one of the good things the government have done in terms of a lot of the funding we've received to date is keep sections of business afloat, at least for the first 6-7 months of this financial year. And then finally, probably there's significant new ways of working. I mean, I know boroughs in London who have got investment in office accommodation who have got no one in that office accommodation from a year's time because people have now found a different way of working and have actually cut their cost basis. So there's lots of things in the mix. Opportunities, and one's the flip side of that. Can we use our office and property portfolio in a better way? A reassessment of services. Do we need to deliver everything we are delivering at the moment? Because some we have relaxed slightly. And, you know, we've always got to look and learn from other councils as well. What are others doing? It was interesting to look at some of the councils that have done emergency budgets this year. We've done the vast majority of things that they've got in theirs, but it's always worth just looking around and seeing, have we picked up everything everyone else is doing? Especially as for the first time in probably 2 or 3 years, councils are putting their heads above the parapet because they've got to, in terms of things. You know, we've been potentially with our heads above the parapet in the last year. A lot of people have copied some of the things we're doing. Now, if we can get learning points from other people, it helps, and it gives us a way, because if it's local government to local government, they're very happy for us to go in and actually say, this is how we did it.
Okay. Councillor Farouk.
Thank you. It's Councillor Allen, is it?
Thank you, Leader. Thank you, Councillor Farouk. I did indicate I wanted to ask a question earlier. I think a lot of it's been covered off, but bearing in mind the imponderables we're dealing with and the unpredictable scenarios, what is your view with the approach set out to the 21-22? Councillor Seaton did indicate he would cover it off, and I think he has done very well, but I'd still like a bit more reassurance that we are comfortable with where we are going and how we're dealing with it.
Councillor Allen, I think it's a very, very fair question. What we, like all councils, got to do is understand what our gaps are to begin with. Look at what we've done to date, because we did a series of lean reviews in January and February. Review those to see what savings we can make and what other savings can be made in the first tranche. But the important thing in this process is to try and fully understand the gap as it evolves, and it might go up in some months, it might go down in others, depending on changes to government legislation. But we've got to be agile and nimble enough to take advantage of that, but at the same time, be ready when we get the final government settlement to know exactly what we need.
Thank you
very much. Thank you.
I'm not sure that's reassurance. That just means you've got to wait and see. Right. David, do you want to sum up? Oh, Wendy, you wanted to come in.
Yes, thank you, Councillor Holditch. I just wanted to add on to what Pete was saying about the pressures and known and not known. I think within the COVID report, we did note the fact that we are expecting to see an increase in referrals for children's social care, particularly when the schools start to go back. So we know that there are challenges within family relationships because people have been together so long. We know there's been an increase in domestic abuse, and we're pretty sure that some families will struggle getting their children back into school. In adult services, we know that there is latent demand. So some people with health needs have not accessed, or not just health needs, health and social care needs, haven't actually accessed the services that perhaps they would have done previously, where we would have put in very early help type support. And what we think is likely to happen is that actually as the lockdown releases, you will see those people needing support, but they're going to need additional support because they haven't accessed support perhaps as early as they might have done previously. So I think that's really important. Some evidence we're getting is around our carers who've been brilliant. So looking after their families and friends in the community, they're starting to say to us they are tired and they need more support. So I think we just need to be very aware of that. And as Pete said, you know, we have put those business cases forward to finance so that MHCLG are aware of those pressures we think we're going to get, maybe not now, but as the lockdown releases coming through to September, October towards Christmas. Thank you.
Thank you, Wendy. Can you sum up, David, please?
Thank you, Leader. Yes, I'll start by apologising to Councillor Walsh for the coding. I'm suitably chastised, but I have to admit, as I'm colourblind, it all looks the same to me. Councillor Fitzgerald, just to touch on the council's overall financial position, I think what's really important is we're given time, this is councils are given time to deal with the current position. And we've put forward to government some ways that we could be helped with that. When I talk time, I mean years, 3-4 years to recover from this. So we've suggested things like a 1-year holiday on paying back capital amounts. Our pension fund is nearly fully funded. Could we have a holiday on part of the pension contributions? Things like that could give quite a substantial sum to help councils for a 2-year period, 3-year period, start to recover, businesses recover, income recovers, things start to return to normal. Councillor Allen, Wendy touched on this. There was an American Secretary of State who was ridiculed for unknown unknowns. And I have to admit, at the moment, it's the known unknowns frighten me. And I'm sure there's some unknown unknowns out there we will hit us at some stage.
You're right.
That's the world we're in. And as for risks, connected to that, if you talk to economists, I don't think any of them come up with the same position for what our national economic position looks like. None of them come up with the same projections. So we don't know, with the pandemic size it is across the globe, how that will affect our national financial position. It must inevitably do so. And that, for me, is a really big risk. But just to go back, Leader, I'm pleased to recommend to Cabinet this report, and I hope it will be agreed. Thank you.
Right, thank you, members. The recommendations are set out on page 25 of your report. Do I have a proposer, please?
I'm happy to propose, John.
Councillor Farouk, thank you. Seconder?
Happy to second, Leader.
Thank you, Councillor Hiller. All those in favour? I don't see any objections. Do you, Pippa?
No, no objections.
Right, so thank you, that's agreed. I think, Pippa, that brings this meeting to a close, isn't it?
Yep, that's it. That's all the items.
Thank you, members. A very good meeting. Thank you. See you all later.
You, Leader.
Thank you.
See you all later.